So some of the questions I get frequently about subvastus knee replacement. One, what's the recovery timeline? How much faster is it? Well, we're still doing a knee replacement. We're still cutting bone. This is still going to hurt. But what it can do is speed up that recovery. Whereas patients on a traditional knee replacement can be on a walker for 2 or 3 weeks. A lot of patients are coming in only on a walker for a week, maybe 2. And they're just recovering faster in terms of their gait. Certainly taking less opioids, requiring less pain medicine after surgery. Overall, the procedure is relatively similar. Again, it's just a matter of where we get access to the knee. So the incision is slightly to the side, whereas a traditional medial perpatellar is down the middle. But everything else externally is going to appear the same as a traditional knee replacement. It's on the inside that counts, and that's what we're doing differently. Another question is, who's a candidate for a subvastus approach? I already mentioned that it's technically a little more demanding surgery on my part than a traditional knee replacement. In reality, there's very few patients who cannot be done via this approach, and I would argue that almost everyone can. Even patients with stiff knees, bad range of motion, we're still able to do the procedure and do it well in those patients. Pretty much I go into every knee with an expectation of doing a subvastus approach nowadays.